Good morning. Welcome to Salina Regional's Morning Medical. Today's program we're going to be talking about a couple of muscle movement conditions. With me I have neurologist Doug Davis with Salina Regional Neurosciences. Thanks for being on the show. In particular we're going to be talking about dystonia and spasticity. So first of all, what are these conditions?
So dystonia and spasticity are almost like a spasm of a muscle or a cramping of a muscle that just doesn't last, that short period of time that we think of when we think of a Charlie horse or a cramp. It's more of a chronic condition.
Okay. Obviously there's usually underlying causes with this. What causes these?
Correct. So our brain is what tells the muscles to move or not move. And what happens is you have a disconnect from the brain to the muscle and an abnormal signal going through the nerve. And things like stroke can cause this, multiple sclerosis, cerebral palsy, any type of spinal cord injury or a traumatic brain injury can even cause the spasticity or dystonia.
So we know the causes, how do you treat them, or do you treat them differently?
They can be treated in the same way, the dystonia and the spasticity. The important thing is that you treat them early, because what can happen is you can get contractures of the muscle to where if they're not treated early, it becomes a permanent abnormal tone in the muscle. So the things that we have to release those muscles or relax those muscles are things like muscle relaxers like baclofen, even baclofen pumps, which is a pump that you wear that has a continuous infusion of the medication that helps with the spasticity. If it's a focal spasticity in one specific spot, we can use things like Botox that blocks the transmission between the nerve and the muscle.
Okay, you had mentioned treating early. I mean, at what sign, or what are some of the early signs of these? Obviously a stroke, we know the early signs of that. Are you looking for it in every stroke victim?
Not necessarily every stroke victim. A lot of times physical therapists, while the patient is doing their physical therapy, or occupational therapists are the first ones that notice the abnormal posturing, and that's what we start to look for, is abnormal posturing is like a first sign.
Okay, that was about stroke. Some of the other conditions, what are the people seeing when they need to contact you?
Right, it's the same thing. It's an abnormal posturing or like a spasm of a muscle or a cramping of a muscle. So when you think of your leg cramping up and it draws up, that's kind of the same.
Thank you for watching. For more information, please visit src.com, like us on Facebook, and follow us on Twitter.